All right, well, welcome to the Hychara Health Exchange today. And today we're going to be talking about quality and patient experience. And we have a couple of guests with us. So I'll let you guys introduce yourselves.
My name's Adam Wachter. I am a clinic director with Therapeutic Associates.
My name is Steve Pearson. I'm the Patient Experience Manager for Therapeutic Associates.
And I'm Chris Hoekstra. I'm Chief Clinical Transformation Officer for Therapeutic Associates and also Hychara Health. So first question we'll kick off with today is we'll talk about quality. And we define quality one way oftentimes in physical therapy. How can we, or let's talk a little bit about clinical quality and our definition, how that relates to our patient's definition of being cared for, and what are some things that we can do to align those?
I think patients being heard is the biggest way that we can create some quality care. I think most patients are used to a traditional medical system where they're being told what to do, a bunch of different places, imaging, docs, all these different places, and all they really want to be done is to be heard, their story, and then kind of helped along the path to get better. So to me, that's the best way to align quality patient care kind of from all angles. It's just to listen to the patient.
Yeah, and along those lines, when patients are scheduling, sometimes they're waiting to get to their provider to be able to start sharing that story and feeling heard, but I think we can actually start that earlier in the process. When they're being scheduled, we're already asking them, why are you coming to see us? We can ask a few additional questions to help us to really understand better what they're seeking. We could ask, have you been treated for this before? What did you find really helped? What didn't help? And if they can share that forward with the provider, you get a better insight into what is it that they're looking for, and it shows that we're good communicators as a team as well.
So, I mean, I think we'd all say amen to those things, and we got into this business to be able to help patients. Where are some ways that this has maybe gotten off track? Where do we feel like where we're focusing in physical therapy, let's keep it focused on quality, where we're focused in quality is missing the mark on hitting that patient on what they need?
Well, we can sometimes miss the mark because I think everyone gets really into the whirlwind of the day. We can sometimes overlook some little things. Patients coming in, maybe they're having a hard day, they're running late, and they kind of get rushed into the process. And sometimes that can feel a little off-putting because now they're directly into, okay, we're working on this, we're talking about this, and maybe there isn't that time to get them in the right mindset and being able to feel like they can tell you what the problem was that day or what is going well, what's not going well.
I would agree. I think everybody comes in with a different mindset with what they have going on. Some come in and they're kind of towards their last visit and they're feeling great and they're happy as can be. And then sometimes, like Steve had mentioned, they're coming in hot and they're late and they hit some traffic and they're hurting. And I think having that customer service experience, just that great experience from the first person that they talk to, either on the phone if they're on the way in, or the first person that greets them at the door. It doesn't have to be the physical therapist per se. It can be anybody in the office, and making sure that um, we're guiding them along that path, whether in that day or throughout their course of care. Um, but just making sure that service wise, we're listening to them, we're um, helping them along the way and guiding them. I always joke, I think this job almost got me ready for parenting because you have to guide them in the right path, let them fail at times, give them some successes, but help them along their path to get them to some good outcomes.
Yeah, this sounds like customer service. I'm hearing a prevailing thing that we can focus on that. So I guess we'll take a little pivot and raise it up a bit in just quality in general in physical therapy. Let's take it out of the day-to-day interaction with the patient and more as an organization. So Therapeutic Associates has 93 clinics, large organization across multiple states. We as leaders have to push quality and define quality. So we'll take one step over to real extreme. CMS tried their darndest over the last 20 years to define quality one way. So the Merit-Based Incentive Program, MIPS, we collect some outcomes measures, we do certain quality measures with patients, collect their BMI, look at medications, and we call that quality. They then incentivize based on that. Some organizations rate quality as conforming to best practices, so orthopedic sections standards. Some take quality as having good patient sentiment, NPS. We have all these definitions of quality that seem to get us a little away from this core of customer service. Speak to that a little bit. How do you guys feel the things as an organization we do align with keeping customer service focused versus maybe other quality things that don't hit that mark?
The last few years, I think we've done a great job bringing in NPS scores and really asking patients if they, you know, how was your experience? Because I think a lot of from a PT standpoint, we get stuck on the, you know, the patient recorded outcomes and the nitty gritty of the science of physical therapy and understanding, you know, the exact specifics of how they're getting better and where they're getting better and the range of motion, all these little things. Ultimately, it's how are you doing when you ask the patient, right? Did you have, I think making sure that that layer to me is on the top. Um, I can look at patient recorded outcomes and specifics and guidelines for rehab and all these things as much as I want. Most patients don't really want the nitty gritty of that. They just want to get better. They want to get back to whatever they are not doing currently. So checking in regularly, setting goals for the specifics of what that patient wants to do. I think just making sure that the patient is guiding the way, but we're back there kind of pushing them in the right direction. I think that's where we can make the biggest gains.
Yeah, and when we're looking at the operational need to have some of those pieces, outcomes, and I know that some of those things with MIPS, we raise our eyebrow a little bit and think, is this really quality? And maybe, maybe not, but what I think we need to do to really help that to sink in well with patients is to just communicate what it is that we're doing and why we're doing it. If we're asking them to do outcomes, this is going to be something that's great for you to be able to see where you're at, kind of a baseline. We'll watch this and see if you're improving. And like Adam said, we're asking them how they're doing, how they're feeling along the way, but we're also communicating what the value of these other things are. Because if it's like a BMI measurement, sure, that has to do with their overall health, and there's a reason why we might be asking for it. And we just need to be clear that it's not just another random, here, we need to collect this, and we don't say anything about it. If we at least give them some context as to why that's relevant, it helps to elevate that experience a bit.
So I'm hearing two things. One, they don't care about a lot of things that we care about. It's basically, I need to get better. I guess one point I would make is that we have to define what's better from the patient's perspective and make sure we're delivering on that. But then I'm also hearing if you have to collect other things because maybe we're incentivized to, maybe regulatorily we're required to, that the patient understands why this is important, and it's a communication thing to try to bridge those two. Because in the end, what we're trying to do is say, yes, what's important to you is important, and there are other things from my professional perspective, for lots of reasons, are also important. Can we come together and both push those? Does that seem all right?
I would agree. Yeah. The biggest focus would be that goal is set on what they want to return to. So using functional scores and asking them that to me, that shows me a direction of where you were here, but you couldn't do this. You wanted to do that, and now you're doing it. Um, Maybe there is some pain along the way. Maybe it's less. Well, hopefully it's less. Hopefully it's gone. But I think measuring that improvement in are you doing what you love to do again, whether that be picking up their infant or jogging or going up the stairs. I mean, it's a bunch of different. It's specific to that individual. I can kind of stay underneath and feed them good information on, I see this is better, and then this thing is better, and the strength is better, range of motion. But ultimately, it's that what they chose at the beginning. We help them in picking those things because I have to weed out, why they're in my office. But getting them to that spot to me is the biggest piece.
So Hychara Health is a health tech company at its core, but basically using that technology to drive better practice and better business. So let's start with how has technology helped you in the aim of doing that as a provider, and then maybe in your role, how have you seen technology help us as an organization be able to move the dial collectively?
So when we're looking at just overall numbers, sometimes we can look at functional gains on average for a provider. And if we can see that somebody is maybe struggling. They don't have patients that are responding well in a certain area for maybe they're treating lower extremity and outcomes are kind of lacking there, but they're doing great with shoulders, elbows, necks. It's a way for us to help to guide education for providers to help them along the way. Um, and you'll have to prompt me again with what the question was.
Yeah, just
because I
as an
lost track.
organization, how we use technology to better bridge that gap between our definition of quality and the patient.
Yeah. So especially when we're looking at patient feedback, our net promoter score results, we can look at the scores by themselves, which are sometimes helpful, but we focus in on the comments to see what is working well and what's not working well. And sometimes we see a really close correlation there. We see people who say, man, I loved everybody. Everyone was very friendly, responsive. Care team was great. The aides helped me with my exercises. I felt engaged the whole way through. And it's such a great story. And then you see the other side of that where they're like, my provider was fine, but then they stuck me with somebody doing exercises and I didn't understand the point of this. And I felt like I could have done this at home. And that really helps us to understand where maybe we're missing the mark with engagement. And that can show its way in numbers with self-discharge rates. It can show in how maybe our overall net promoter score starts to come down. Sometimes that's other things, patient drop off. So I think that those are things that we can definitely watch data-wise to help us to structure what we can do to keep things on the elevated side.
So it sounds like technology, and I know some of the background of this. So one, it sounds like we can automate getting response requests to patients so they can give us that feedback, whether it's on their outcomes or whether it's on their sentiment on NPS. Two, it sounds like once we get that, we can pull it together and identify over or underperforming providers or body regions so that we can intervene surgically rather than globally. And then it sounds like as an organization, we can find themes. Now, as we pull that data in centrally, we can find themes of let's look at all of our detractors, and all of our detractors seem to have this common theme of didn't explain my benefits. Aides didn't seem like they communicated well with the staff. So that theme generation, so we can work bigger. Is that?
Yeah, and speaking to the technology side, thank you for the prompt there. We ask for that a couple of times during care. So within the first week after they've seen their initial visit, we'll ask for that just to get a sense of where they're at. And if we do find that somebody's rating low, we will prompt clinics to follow up with the patient and see what can we do to try and hopefully retain that person. See, did something go wrong during that initial assessment? Maybe they just haven't had long enough in care, but at least it gives us an early marker. And then we do it again after 4 weeks to see how are they doing. Sometimes patients have dropped out before then if they didn't have a good recovery on that first measurement, but sometimes we see it coming up and it's a good thing because we've been able to intervene. Patient is now there, so there's the retention, they're staying longer, and their scores sometimes will get better after that.
Yeah.
So it's a good way for us to use that technology to make sure that we're getting constant measurements. And yeah, it's automated, so it's not something that clinics have to fire off manually.
Yeah. So I guess that my background as an informatician, in addition to PT, is this concept of socio-technology. We've talked about that on the podcast before. It sounds like the technology is great. It'll capture the data, but there has to be a psychosocial component. If someone sees it, you can help intervene to the clinic to say, hey, talk to the person. There actually has to be this connected loop, or else the data goes into a black hole and we don't do anything with it.
Absolutely.
Yeah. How about if we pivot from the provider standpoint, how has technology helped you bridge that gap between kind of, again, the company's definition of quality and the patient's?
Yeah, as a provider, you touched on NPS scores and kind of sending out follow-ups with the patients, which I think is great. What's better on the provider side is that over the years, and you might not know this because you pushed me a couple times to change things. All right, try to do an entire eval without bringing in, your clipboard and the paper and writing and all that stuff. So went away from that, and all of a sudden it's like, oh, I'm right there with the patient. I'm not looking down at my at my board. Um, Next one was, working with a scribing tool and closing notes before they're done. All of this gains me time to basically do this, to look patients in the eye, to be able to chat with them, to listen to their story. To me, that's where the quality turns. It'd be great if we can go back in time just to see what their perception of care and how much the provider was listening to them, 10, 15 years ago, as opposed to now. But the technology has advanced enough to where I can get all my stuff done and it's more readily accessible, right? It's not in this big giant folder and I have to flip through things. I know where things are. I can show the patient and I can leave it aside, listen to the patient, and it's capturing all the stuff that I need to do. So my job is a little bit easier. They're being heard for a longer amount of time, and I can get more done in those visits. So technology has allowed me to be more efficient as a clinician, which has been fantastic.
Yeah. So it sounds like a big one you're speaking of is the ambient scribing has really turned a corner. In that, it sounds like I heard a couple of things. One, it allows you just to be more present with the patient, which then could free you up to engage with them. You can think clearer. You just don't have this distraction. But the second thing I heard is it allows you to get your thoughts where before you'd have to put them in the system, not only be engaged, but be assured that data is in the computer. Anything else it's done to help in that quality world?
Um, Made my notes a lot cleaner and better. I've been doing this for 22, 23 years. So in that time, I could say I was maybe a little bit lazier in some of my notes over the years. And sometimes you're in a rush, you got to get stuff done. This captures everything. So compliance wise, it just nails it down because everything that I need to be in the note is in there. It's more thorough and allows me to kind of go back and forth. I don't have to go, oh, what did you say on the eval? I can actually look back because it's there because I didn't forget to write it down or type it in because God knows I can't type as fast as some. So it's efficiency, it's completion and compliance of that note. It's a good note that I can look back on, which ultimately all this stuff ends up back in a patient experience envelope.
It's interesting. So outside of my PT role, I'm part of a research team that studies scribing in medicine. So we've done it for the last 5 years to understand. We started with in-person scribing, and then when COVID happened, we went to telescribing, and now with AI ambient scribing, we're studying that. And across the board, every provider we've talked to has said kind of what you did. One, it frees me up. The big thing I'd like to align with you though is they've said it makes my notes better and makes my thinking better because they'll say something in passing. I'm thinking so fast with them that I can't take that rabbit trail and I'm on my trail. I come back and either my person scribe or ambient scribe put this thing down and you're like, wait a minute, that was I didn't see that before. Have you had those instances either with in-person or?
Absolutely. I mean, like you said, you're trying to think. You have that patient in front of you. You're really trying to think a couple steps ahead, taking in that information and trying to formulate what you need to do. Where is it going? How am I going to make this individual better? And some things just kind of just go by the wayside. Not because I didn't care, just because it's a lot of information real quick. So by having somebody or something listen to me on the back end, I can get all that information down and I come back to it a lot more easily.
Then we could do and we already have done a whole talk on the ambient scribing piece. If we come back to this concept of what's important to the patient is what's important to the patient and how do we manage that? Are there ways, in the eval it sounds like ambient scribing has helped. Are there other ways technology has helped us to be able to better stay aligned with and manage that patient expectation, the patient's definition of quality?
I think so. You look at the fact that our EHRs now are able to data share, and oftentimes you'll hear patients, they go to their primary care, they go to their dentist, they go to their chiropractor, they go, then physical therapy, and everyone's asking for their medical history. And they get frustrated at the third provider that I have to fill all this out again. And so when we're able to pull some information in from other sources, that can save the patient's time. They're not spending as much time in the waiting room filling out that first intake process. We get a little bit of information from them, but it's not that laborious health history, medications, all these other things that can take so much time. When we're able to pull that in an interface, now the providers have a way to look and see, here's their health history, what they pulled in from that other provider. And hopefully that helps to really, speed up the time for not only the providers because they're not waiting for the patient to complete that, but then the patients also realize, hey, I filled this out over here and now they have the information. This is great.
So just anecdote we have here. So we about 5 years ago changed our intake process from probably 5 pages we had the patient fill out on paper, tons of questions to down to 5 questions, and then leveraged interoperability to bring in the data from other sources. We had providers, interestingly at the time, say, well, why are we changing? My patients aren't complaining. And we said, well, that is a pretty low bar for us if that's what we're trying to do. Versus to your point, I think patients want to feel like I'm not wasting my time. I would like to feel it's different. We implemented this change and we had patients write us, and you saw these comments like, this is amazing. I've been in the healthcare system for years and never have I had such an easy process of intake, and the fact that my provider knew all this stuff about me and I never had to say it again. So the fact we can wow patients with technology, I think that's something we need to strive for versus just not have them complain about it, because that's ultimately what the history has been, is as long as it's not too bad, then it's okay. How about we pivot a bit with the time we have left, and then we'll come back to a more positive topic. Where does technology get in the way of that? We've talked about how it helps. Where's technology gotten in the way of giving quality or value to the patient?
Sometimes it can be a lot. So to the point that Steve mentioned, I can get the entire health history. So if I have a new patient, I'll look in the chart and kind of see what are we going to go over, what's relevant in their prior medical history. It may pull over 700 different notes from prior doc visits, right? And the patient's kind of asking. So sometimes it's too big. It's too much information for the provider. So trying to find a way to streamline that a little bit better. So now we pivoted from, the patient coming in, sign these 75 sheets. I'm going to write down my insurance number 14 times. You're going to, even though you already have a copy of it, now the provider, at times, not all the times, I think can get in the way because there's too much information on our side to look over. At the same time, we're trying to piece this puzzle together for the patient. So finding what's relevant and how do we weed that stuff out, so we can be more, that comes back to efficiency.
Yeah, and this is great. I mean, getting the data first step, and I think some technologies have stopped there. The power of AI and machine learning would be to now give me the summary of this. Go to any chat GPT. If you put those 700 pages in the chat GPT, don't do it because it's not HIPAA compliant. But if you were to do that, you would get, and give me a 5 bullet point summary of the most important things. AI can do it like that. So I agree. We've shifted the burden from the patient to the provider. And in some respects, we should have, because for years we pushed the burden on the patient. But now our providers are burnt out. We take away a little burden with AI on the ambient scribing. Why can't we do it on summarization? I think we're right there. We just need to push tech to do it. Any other ways you've seen?
Yeah, I mean, sometimes we're still using things like a iPad or a tablet to ask patients to at least give us some information. Sometimes it's to get some of their functional assessment information, and we always have technology fails. The Wi-Fi stops working, your battery runs out. Patients might not understand what they're looking at. Some people they forget their glasses, they're slow with reading it, and sometimes our staff members aren't able to assist them. So in that way, it's like we're relying on the technology for this bit of information, but there's a struggle for it. And so it can be that level of burden that we have with how long is this going to take? Is it easy for them to get through? Are we prepared? Do we have everything in place for it to be easy for them to put in? For the most part, I think we're successful, but there are those times where you get the person who just doesn't have the ability to navigate with technology, and so we have to be able to step in to help them if we need to.
Yeah. So last question. Let's look forward, and you're going to give counsel to the tech vendors of the world and the companies of the world that want to keep the patient's focus, to take burden off of providers and help organizations to see where they need to focus. In your utopian world, what's one area that could be improved? You could tell me what to do about it, but more importantly, what's one area that we could improve with technology and quality?
I'll add to the noise. Technology to me is a great way to make, get all the information, be more efficient. But I always think of it as kind of the human brain. It's this super complex, organ in there doing a jillion things at the same time, and we use like 10% of it, right? So finding a way to keep technology simple, make it work. I want to turn it on. I want it to be there. I don't want to glitch. So all the smaller things like Steve had just mentioned, the app doesn't work or it powers down. And I know there's a lot of layers to that in talking with our own IT team. But I think in the background, yes, it could be complicated. but from a provider and from a patient standpoint, just keeping it simple. So making sure it works, it turns on, a couple little things that you need to find. If you need to find it, you can, but don't make that interface too complicated.
Yeah, so it sounds like three things I heard. One, hide the complexity. It can be complicated, but as long as that complexity doesn't hit the provider. Second one is keep the interface simple, and probably you would also say aligned in my workflow, so I don't have to do something different. But then are you also saying, don't give me so much? Like there could be 1,000 awesome things. I would much rather have the two most important awesome things to this patient to kind of limit what it gives you as well.
Yes, and I think um, to your first point, keep it in the background. I want that stuff to be accessible because there may be one out of my 100 evals that I need to find that thing, um, but don't have so much right in front of the provider or the patient right away.
Yeah.
Yeah, and exactly mirroring what Adam said for the patient as well. Something that's simple, concise, we don't ask too many questions, and that it's in a pleasing format to look at. I mean, we sometimes dismiss, give them a black and white screen with questions on it, that's functional, but give it some color, give it some style, give it something to make it more of an enjoyable process to go through, smooth, snappy, quick. Those are the things that will help to patients to feel like, hey, this isn't so bad. It's not 16 questions on a page, it's maybe one or two, and you keep on going. And as long as we can keep it to that 5 to 10 questions and get the relevant information we need, I think that's going to be super beneficial.
Yeah, I'll just combine yours and my last, what I've gained from you. I would say also make it change our mind. Make it change what we do. Use it. So at the patient level, you've done all this work, you better darn well come back to them and say, well, you did this and here's what we saw and here's where we are now. You did this and here's where it aligns or doesn't align with what you said was important. Therapist, you made me enter all this stuff for the last 7 months. Why am I doing all of this? So as an organization, this is where it comes to me oftentimes, is to say, okay, we now have all this data. How do we, one, give it back to providers so they can make their care better? How do we give it back to leaders so they can counsel and coach their folks? How we as an organization can change our approaches. I think that's something for another podcast, but ultimately, how do we actually get the data to do something to change us? That's in the end, if we can't do that.